Hello, I'm Marcus Henderson from Phoenix. Recently, I worked as an orderly at the Phoenix Psychiatric Hospital, a specialized forensic facility under the supervision of the Federal Bureau of Prisons. I started my career as a unit supervisor at a maximum security correctional facility in upstate New York. I voluntarily transferred to Philadelphia Detention Center Number 1, the famous Eastern State Penitentiary, back when it was still the old building. After leaving Eastern State, I returned to my hometown of Phoenix and got a job through the Department of Health as an orderly at this institution, the Phoenix Prison Psychiatric Hospital. This facility houses inmate patients who have been deemed mentally unfit by court order. This is a specialized prison hospital, a closed-type facility. It's surrounded by a high fence with barbed wire and a monitored perimeter strip. Essentially, it's a prison, a fortress that's extremely difficult to escape from. Inmate patients are held in cell-like rooms that lock with keys. There are no toilets or sinks in these rooms. Inmates are released to use the bathroom only at specific times. They rush to the toilet, where 2 or even 3 people manage to use one urinal simultaneously because of the time limit. When time's up, another cell opens, another group needs to use the bathroom. Sometimes not everyone gets their turn to urinate. If they need to use the bathroom outside scheduled times, they have to knock on the door. Someone from the medical staff or a Bureau of Prisons inspector approaches, and at their discretion, they'll either open the door or not. The patient has to hold it or urinate in a bag, which becomes an additional punishment. I tried many times to open the door for patients. I wasn't legally prohibited from doing so, but the medical staff and bureau inspectors forbade me from letting inmate patients use the toilet. He should suffer. Plus, he's being punished, so let him hold it. One such patient wasn't let out at the designated time to use the bathroom. He urinated in a bag and threw it out the window. At that moment, 3 inspectors were standing below on the facility grounds. This bag splattered all over them. They quickly found the cell, identified the violator. He started resisting, wouldn't let them restrain him, kicked and fought. They threw him to the floor, held him down by his arms and legs. A nurse standing nearby with a prepared syringe was told, "Give him the shot," one of those heavy-duty medications. They strapped the patient to a special bed, restraining him with belts and ropes, stripped him naked, and covered him with some old, dirty blanket. In general, this procedure is practiced for mentally ill patients who commit some kind of violation on hospital grounds, show aggression, or experience acute psychosis. They can be strapped to this bed for 90 minutes, then they're supposed to be released. There are certain helpers assisting the administration, inmate patients who, at the right moment, slide a bedpan under the patient if they're quick enough. If not, no big deal. The floor's tiled, everything washes off. The plastic sheet can be cleaned too. They can lift it, wipe the patient's rear, and then they continue lying there. Patients are usually placed on these beds as punishment for long weeks. While I was working there, within the first month, not even a full month, another fatal case occurred. A person was lying in restraints, and his body just couldn't take it. During my time working there, at least 10 people died in those 6 months. One patient started touching his genitals during the shaving of his groin area, but that's quickly and harshly shut down there. They strap the person down, inject powerful medications. Naturally, this affects potency and sexual function. It weakens significantly. Yes, medication can definitely be a form of punishment because these drugs have harmful effects on the entire body. If a person is pumped full of these medications, they'll look passive, drool will run from their mouth, they'll barely be able to move, their face becomes pale, they might not even answer questions, or they'll mumble incoherent nonsense. They look like they're about to collapse if they're standing. They resemble a feeble old person, literally a vegetable. Their daily routine starts with wake up at 5:30 a.m. Duty inmates clean the cell. Unlike in detention centers, it's not always the same people from the lowest caste who clean. They take turns. There are no authority figures here, only appointed leaders designated by the administration. At night, they're given a bucket to urinate in so they don't have to open the cells. The duty person empties the bucket into the toilet in the morning, then they wait for Rounds. Doctors come and ask patients questions. Maybe a patient has questions, requests, or demands. Then they prepare for meals. They're led out in groups of several cells. They have to do everything quickly, then back to their cells. Those who have time also manage to use the toilet. Then they prepare for recreation. The recreation yard is a small space, about 33 by 33 feet, 60 to 70 people. It's pretty cramped. You can't really move around much. They're out there breathing fresh air, walking, talking to each other. Recreation lasts 1 to 2 hours. After that, those who need it get their beards shaved if they've grown out, then back to the cells, or they might be taken to the bathhouse during the day, but that's once a week per unit. Then lunch, what kind of food is served? Oatmeal, cheap simple carbs, cabbage with potatoes mixed together. Not much meat, nothing you'd need to chew long. Many don't have teeth. Believe me, nobody's going to treat their teeth there. At most, they'll pull out bad teeth. Quiet time. Then they can occupy themselves in their cells. Read some literature. Those who have prescribed pills take them under supervision, show their tongue to prove they swallowed. Evening approaches with dinner. TV viewing until 9:30. Mostly news. Sometimes they'll put on a movie, then it's back to cells. Brush teeth, use the toilet, and to bed. When a person ends up in prison, like a correctional facility, they have a specific sentence. In a specialized psychiatric hospital, there's no specific term for a patient's stay. Even for minor crimes, a patient can stay there indefinitely, for many years. Their release depends on the chief physician, the head of the unit, the psychiatrist, and also the head of the security department. Once I was standing on the facility grounds with a patient, and he tells me, "Look, they're releasing someone, actually transferring them to a civilian psychiatric hospital. After the prison psychiatric hospital, they spend at least 6 more months at a civilian facility near their residence. This person had been there for 18 years. Even if someone does get released, which is unlikely, what condition will they be in? Weak, feeble. They develop a belly from the cheap carbohydrate food while their legs and arms stay thin. They develop weakness from the powerful medications. They develop conditions like prostatitis and frequent urination. The body might cleanse itself to some degree, but there will always be lasting consequences. Obviously, we understand that many people are there for some crime. The most horrible people I encountered there, well, many murderers who killed even their own mothers, raped or molested a girl. One guy strangled his mother with a phone cord in a hotel room. They're treated accordingly, we understand that too. They're psychos, we don't respect them, they deserve to suffer there. Many people would say that. By fortunate chance, they didn't end up there themselves. We had a case at Philadelphia Detention Center Number 1, Eastern State. An authority figure among the inmates was sent to the psychiatric unit of the detention center. There are 2 floors and many cells. He didn't accept this and started acting out. "I don't want to be here among the mentally ill, among these poor people deprived of reason," as he put it. "I'm a normal, respectable inmate. Send me to the other inmates, the respected ones, not this cell." He started spitting. They put him in restraints, gave him additional injections. This person turned into a vegetable. No trace of the authority figure remained. He became like a pitiful kitten cowering in the corner. Can a person preserve their dignity, their status as an individual? It's unlikely. It's very easy to suppress their will, their psyche. Essentially, you can only preserve your dignity by cooperating with the administration. But not everyone is allowed this cooperation. They choose. I was fired from this psychiatric hospital because it was too difficult to watch people suffer. I tried in various ways to help inmate patients, opening doors for them, their entitled bathroom breaks. I was against strapping people down. They told me, "Mind your own business," the Federal Bureau of Prisons inspectors said. This was right before my termination. Institutions like the Phoenix Prison Psychiatric Hospital, closed-type facilities, of course they should exist. This isn't just some prison, it's a medical institution. People here need help. Moreover, if the court deemed them mentally unfit, psychologically unhealthy, then we need to treat their mind, not humiliate, insult, or pressure them. How should we treat those who, say, killed someone on the outside, dismembered them? I believe that in our country, as in Scandinavian countries actually, there should be humanism. We should treat everyone exclusively with humanity, so they find the path to rehabilitation not through torture and punishment. Executions that, if they do get released, will make them more aggressive towards society, but so they feel ashamed that they were treated humanely, not the way they're treated in penitentiary institutions, including prison psychiatric hospitals. We had a case when I was working at this psychiatric hospital. A construction crew was brought in for building and other work on the facility grounds. One civilian worker approached a nurse and asked, "Excuse me, where's the bathroom?" She said, "Come on, I'll take you." At that moment, 2 inspectors were in the corridor near the bathrooms. They mistook the civilian worker for a patient. The moment he opened the bathroom door, 2 inspectors jumped on him with rubber batons, using brutal physical force and profane language. Realizing they'd screwed up and got the wrong guy, they quickly left the corridor. If there are positive aspects, there's a unit called therapeutic workshops. The staff there are good people. Patients are sent there from the units to sit, make crafts, do painting and drawing, knitting. The contrast compared to the rest of the institution really stands out. It feels like you're entering a different institution, a different place. If it were like this in all units, as prescribed by law everywhere, because our laws are supposed to be humane and they are humane on paper, then this would truly be a necessary, significant institution. They fired me with a black mark on my record, a negative evaluation that included the ridiculous phrase, "communicated with inmate patients." I'm an employee of this organization. How am I supposed to work there without communicating with those in my care? The fact that I'll try to punish someone if I have the authority, or that others will punish them, not necessarily for me, but just pressure them, that won't change anything. You can't bring back what was taken. So even if a person is simply destroyed, what will change in this world?